overlooking what we can offer. So there are many interesting aspects actually that we would like to discuss and share with you, but unfortunately it's only part of the team who could attend today, and obviously there'll be more sessions coming as we go along in the future, so we can address other aspects. That there are several important things when we talk about progressive MS, and that's not just from the clinician perspective, but also from the patient's perspective. When we look at the options, what we can offer, we always try to see what the individual patient actually needs. And we do know that the MS and progressive MS is that the illness which constantly is changing patient or the person's physical abilities, and all that constant change is very challenging, not just for the individual, but also for the patient, for the patient's relatives and the friends and the workplace, and that comes with a lots of psychological difficulties. And just the way that Eli described her experience to us, if you listen to her story carefully, so she was telling how she was in a dark, foggy place, and she wanted to be understood. She was dealing with the different emotions, and it took years for her to not to let the MS to control herself, but until she actually become a controller of her MS. And that is an important aspect that we clinicians and the patients share and join on the same journey. So it is well recognized that the patients with chronic illnesses, not just MS, but the same as many others, are more likely to feel depressed, and that's because of all these inabilities and the different aspects that they have to face on a day-to-day basis, and that often leads to the depression. But once you are in a depression, it becomes a vicious circle, and actually you then stop doing the things which might benefit you. You stop exercise, you stop self-care, you stop socializing, you withdraw from the community, you stop looking at what you actually put on the plate. So you just take what is easy. You think that the life is over. And that actually makes the disease worse. So there are various aspects of when you have to look at progressive MS, not just about the treatment, it's actually seeing yourself and what you can do to yourself. That is very important thing to start. I could, whilst I was listening to the previous talk, there was a question I think I can a little bit touch, because that's is a part of the way how you can help yourself. There was the mention about the obesity, about the weight gain, and I can agree to the patient who was saying that actually the weight increase started after she got MS, but that what the research show, and that is how I personally translate that. It's obesity is one of the significant cardiovascular risk factors, and that is very much showed that the more you look after your cardiovascular health, the better your long-term prognosis, because lots of progression is associated with also the poor cardiovascular health. The more you exercise, the more active you are, the better your cardiovascular health, the better food choices you put on your plate, that helps. The same with the weight. And that just goes on. So, so ideally, people with progressive MS should receive more like holistic approach in the care, where you look at the all aspects, not just one simple thing. And then, as you saw in Hannah's presentation, there are various key research areas which are mainly focusing on how to stop or impair or stop or prevent the immune damage or myelin repair, or how to protect the nerves from damage and the symptoms. But there are many other aspects which actually need to be looked. And we we have a study running currently at the Walton Center, run by Professor Young and Dr. Mills. It's called Tonic Study, and we very much are interested in seeing the results because they actually focus on those aspects, how the living with MS impacts the patients on a daily basis. So once there are more data, we might be able to invite other speakers to present. Okay, so